circulatory system is of vital importance in the well-being of the body. More than 1/2 of all deaths in the United States are caused by failure of the heart or blood vessels. Most circulatory disease occurs because arteries become clogged by the buildup of plaque, causing a thickening of the artery wall made up of fatty deposits. This process is called atherosclerosis. In some cases, the thickening becomes hardened by the formation of calcium deposits, a process called arteriosclerosis. Various factors add to the risk of plaque formation, including high blood pressure, cholesterol level, activity, smoking, and being overweight. Smoking is a major cause of cardiovascular disease. If you are under 50, smokers are 5 times as likely as non-smokers to die of coronary heart disease. If you stop smoking, you'll also avoid lung diseases like cancer and emphysema. If the clogged circulation affects the coronary arteries, which provide oxygen to the heart muscle, a heart attack may result. If the clogged arteries affect the blood supply to the brain, death of nervous tissue may occur, causing a stroke.